think we're gonna start. All right, well, thank you everyone for coming here today. Before we begin, I want to introduce myself. My name is Caitlin. I'm a community organizer with the Alexis Hill campaign. Alexis is right here, give it up for her. Thank you. Before we begin, we want to acknowledge that we are gathered on the traditional homelands of the new Southern Paiute people. We honor their connection to this land and recognize the ongoing impacts of displacement while committing to listen, learn, and support Indigenous communities. So we're here because unaffordable housing is plaguing Nevadans. Alexis is committed to actually listening and building solutions with community. People are getting priced out of their apartments. At the same time, more of our neighbors are living on the streets and in their cars. Families are one paycheck away from losing everything, and every day housing becomes more unaffordable for all of us. Before we go ahead with the conversation, the restrooms can be found over there to the left, and the program flow will go as community speakers will go first, and then Alexis will introduce her policy. And then we will have room for audience Q&A. We will be hearing from a local organization who deals with housing directly, Nevada Homeless Alliance. Thank you.
It's a blur. So my name is Dr. Katrina. I'm the Executive Director of Nevada Homeless Alliance. Oh, okay, we got fans. We've been here long enough for people to know who we are. And, just a little about myself. So, I don't just know homelessness from textbooks, Dr. Katrina, from working in the field for over 16 years, or from just driving around looking at people who are experiencing homelessness. I know it from another lens, which is lived experience. I was homeless on the streets of Las Vegas from 2000 to 2009. Then I got some help, and I got addicted to education. Here I am today, 16 years later. Okay, mic closer, I'm so loud. And so at Nevada Homeless Alliance, we advance collaborative strategies to end homelessness in Southern Nevada. We partner with mainstream organizations, community, nonprofits, people experiencing homelessness, as well as a group of people that we hire who have lived experience of homelessness, because we feel like if you're closer to the problem, you're closer to the solution. So we do a lot of stuff in Nevada Homeless Alliance. You can look at our website to see more about that. But I wanted to talk a little bit more about affordable housing in our community from our lens. So Nevada Homeless Alliance is my lens, so we think alike. We're besties. So affordable housing in our community, I think for one, we need to define what that means. So there's a lot of affordable housing, and it's 80% AMI or the poverty level, and I don't know if it's intentionally or unintentionally leaving out the people who are below 50% area median income, which is considered low income, and the people who are below 30% area median income, which means they're extremely low income. So in that under 30% area median income, that includes the people who are on fixed income. Some people only get Social Security disability. And it's not like, go supplement your employment and get a job, because they're disabled and there's many jobs that they can't do. And so there are senior housing and there's all these housing programs, but they're wait lists, right? And so individuals are getting priced out, hedge funds are coming in, buying up the property, displacing our low-income residents, and they're like our homeless population of people who are seniors and disabled individuals continues to increase because they're being priced out. So of course, we can put them on a wait list for senior housing. We can build senior housing that's gonna be here in 2028 or 2029, but people are dying on the streets today, right? So we need to do something today. And I think it's important to work with our community partners. Like, we will put a person on a wait list, but unfortunately, sometimes those beds don't open until a person passes. Because once you get in it, you can afford it, you stay there, right? So with the definition of affordable housing, I think we need to be clear about what that means. Affordable for who, right? This big block of people under this percentage, 80 percentage, is a lot of people. But if these developers and individuals, whoever, are building the housing, developers with the funders are not prioritizing some of the populations that they fit within that income range, but there's really nothing for them, because then when you see the eligibility, you gotta make this, and you gotta make that, and you gotta make that. So it's not really designed for people under that. It's probably designed for the people in the top 15% of that 80%, not for other people who are just priced out. And, in other states, they have policies like if a new development comes up and there's not a certain amount of units for extremely low income, they gotta pay into the state fund. Like, what does that look like in our community? We should have that. If we have it, organizations like mine, who's been around for 30 years, have never heard of it, been able to tap into it, and we don't know what's going on with the money. Okay, we don't have it, so we need it, right? I think another thing, and I can't quote numbers right now, but there's a lot of people who live, rich people who live in other communities that are coming here, buying up neighborhoods, and they are renting the homes out. And, is any of that money coming back into the community? I don't know what that looks like, but I'm thinking probably not, right? I live in Texas, I'm a billionaire, I own all this oil stuff. Let me go buy this whole 5-mile radius in Vegas and just get rich, right? But what is anything coming to our community? Come here, get tax cuts and all that, but our community is suffering. Even though we're growing, we have all these, teams and stuff coming, we're growing, but, we're so focused in our community, I'm talking about Southern Nevada, on entertainment, that we often forget the people who live here, right? People are getting homeowner loans, first-time homeowner loans, and they can't even use that loan to buy a house because people are paying the home price over in $20,000 or $30,000 over asking, right? So that just wipes our people out. I think another thing that affordable housing, for one, is a crisis, but the wages are not keeping up with the housing price. How can a person that's making $12 an hour even afford a studio in our community? You have to work like 2.5 jobs in order to do that. So there's a lot of things that's just not balanced, and I think we need more focus on the humans and humanize the people who are residents of this community and see what they need, more things like this, not just, no shade, when there's an election, but on a regular basis to see when these developers are coming in. They should be doing town halls and talking to people, right? We need to have more forums where people who are living on the ground and experiencing the things are able to have their voices heard, so that laws and ordinances and governance and even new teams and new buildings that are being built are including the people who are living here. How much time I got? There's no timer. I guess I go 12 more minutes. I got 3 minutes. Another thing that I think is vitally important when we talk about affordable housing, we need more programs like permanent supportive housing programs. A lot of people in this room may not know what that is, but it's working together with people who may have behavioral health issues, and providing case management as well as like some housing support through funds. And so, like, when we think about people experiencing homelessness, the first thing people want to say is that drug addicts, people with mental health issues, vagrants. How many people do you know that have a job, that pay their rent, that maybe drink sometimes or party on the weekends, or may have a diagnosis and take their medicine every day, right? So we can't look at the people experiencing homelessness as only experiencing that thing, because with housing, they're able to connect to the resources they need. They have an address to get their mail. They may have a phone. You have a shower and you feel better about yourself. And with support surrounding all that, they could be just tax-paying members of the community with support. So I like to humanize the people that we serve, and I think my 10 minutes is up.
Thank you. Next up, we have a local resident who is familiar with the issues everyday Nevadans are facing personally as a resident.
Oh, you have a mic. Me? Wow. Do I just like push it or just?
Hello. Hello, guys. My name is Karlin Martinez. I am a Las Vegas resident. I have been here for 30 plus years. I know I don't look that old. I get it all the time, don't worry. I actually love Las Vegas. When I say I grew up here, I grew up on Fremont Street, so I got to experience the homelessness personally as a child, and still to this day. I am also a content creator, an entrepreneur. I am a pre-licensee for real estate. I'm going to school for political science at CSN, so I get to deal with a lot of the youth, the homeless population as well. So I see, like you said, the mental health issues. I actually post this content, and I'm sure you're aware. And I see the complete issues. I hear about them. I have experienced them personally. So it gets to a point where, like you said, we have to create this environment for them to be able to reach those resources, because I feel like they become something called in gaming NPCs, non-player characters, where they just go day by day by day by day. They wake up, get some water, get something to eat, mope around, do whatever they do. You know, no one to really give them that structure or help them, guide them into what we call stability, because they're stuck in that. And it's messed up, it really is. Someone that deals with mental health, I personally deal with it. You do have to take your medication. But at the same time, I feel like the guidance is very much needed, especially here where it's kind of like a gaming server. You see everything. I know you can see it in Summerlin, you can see it in Henderson, you can see it in North Las Vegas, anywhere. You can see everything possible, from somebody picking through trash to, I don't know, somebody wearing a pumpkin naked in Summerlin. But you experience these things, right? So we get to a point where housing is something very important, especially when I come from poverty. I grew up in a very, very tough neighborhood. I'm sure you guys know what like 28th Street area is like. I actually grew up down the street as well, so I've kind of been scattered. As far as it goes, when it comes to housing, I see where people are coming to buy these things. The problem is distinguishing what is okay for people to buy and how much is okay for them to buy. Having 100 houses within a certain amount of a area or whatever is not okay, because then it creates this dependency on them, and then we don't have access to that. Whereas youth, we're depending on 5 or 6 people living in a house in a 2-bedroom, and it's starting to become overpopulated or saturated, and we don't really have anywhere to live by ourselves anymore. We're becoming dependent on one another versus, you know, being alone. Right out of college, you know, graduated, we can go and have a 1-bedroom by ourselves, have our car, have whatever we need, and we don't feel like we're getting that at this point. I'm 36, just to give you an idea, and I live in a 5-bedroom with my mom and my 4 kids. You can only imagine 2 women trying to keep up a $1,500 mortgage and then still have bills and car payments and all of this, and still going to school and all of that. So you get to a point where it's not okay. In the beginning, obviously, yes, I had somebody to buy the home so I can, you know, make my payments, but then you get to a point where they have 10 houses on the block, they're all $2,000, and then you're like, well, should I just buy the house at this point, you know? And if you don't have the credit, or you don't have people to help you, or you can't make 3 times the rent at this point, you know, you get to a point where it's like, okay, so am I gonna rent my closet out to somebody? Like, you know, you start questioning these things. So, yeah, and so I don't want it to be where, like, we're kind of, not to be messed up, but not like LA or California where we're overpopulated and it's so dense and we all have to live in a 2-bedroom and it's 10 people. We're sharing, you know, the fridge, fighting over whose is what. And it's messed up, you know, but I come from that, so it's kind of like you tend to want to be humble about it, but you also want to be independent, you know? I have a 60-something-year-old mom. Let me just tell you, she was like another child. Oh my gosh. And I'm serious. You guys know, like, if you guys have kids, it gets to a point where it's like they start parenting you. You know, hey, did you put gas in your car? Hey, did you remember that you had to call this person for this and that? And so a lot of elders are the ones that mainly are like having problems because they're on Social Security, disability. They don't have kids, or they do have kids, they live somewhere else. And I'm gonna be honest, once you guys get to a certain point, your kids don't really care. Am I right? So and as the only daughter to my mom, man, I love that lady to death. I will not leave, I don't care where she goes, I'm following her. So you get to a point though where it's like people that don't have people like that, they end up homeless and then they don't have a phone. I used to do regional operations for T-Mobile, let me just say, people will come there, don't have a phone, and they will try to find a long lost cousins, to call or whatever. You get to that point though, and it's real. Like they don't have IDs, they don't have phones, they don't have nothing. So having people like you guys give them the opportunity to have an ID, because you know how hard it is to get an ID? Going to get Social Security, your birth certificate, all this, it's so tough. And so having that housing market open, or even having access to something where we can rehabilitate, because that's what it is. I want to be honest. I grew up around certain people and I know what rehab looks like. And when I say rehab, I don't mean oh, you're on drugs. No, that's a misconception. When I say that, it's you're so lost in your own mind at that point. You don't know where to pick yourself up and you need guidance. So I appreciate what you guys do, I'm gonna be honest, because man, it's not easy. I have been yelled at plenty of times by somebody that's almost half naked on Fremont Street talking about food or whatever, and I can only imagine, And with you actually being here and actually listening to us, because the room full of people, we don't really get attention from politicians like that. I think that's something that's very important for a lot of us, is being heard. Am I right? So thank you, Alexis.
Thank you. Next, we will have another community organization who is dealing with those impacted by the housing crisis.
So good afternoon, everyone. My name is Dennys. I work for JFSA. It's a nonprofit organization. We've been in the community since 1977. So this year is our 49th year. Next year will be our 50 years in the community. So we're very proud about that. So now our agency serves a range from birth to seniors. So with an adoption agency, and then our senior services. Now within that agency, we also have our second step program, which is actually the program that I'm the director of. And that's the program that I believe is most impacted when it comes to housing. Now our participants, when they're unhoused, they come to us unhoused. That means they're living on the street. They're living behind a 7-Eleven. They're staying at a shelter. And they come in without documents. They come in with an average of $1,000 income. From zero income to $1,000, right? That is very low, and it's very hard to find housing. Now, besides finding housing, there's all the obstacles of even getting to finding that housing, right? So we have landlords that let's see, review credit. They don't have no credit. They have bad credit or no credit. Both are bad. They are reviewing documents. They come with no ID, no birth certificates, no social securities. They are also reviewing backgrounds, evictions. And unfortunately, every single one of our participants has an obstacle when it comes to housing. So it's very difficult to move clients into an actual unit. Now, in average, we try to go ahead and house a person within 30 days. It takes about 44 days in average for us to house a person nowadays. And it's because of the lack of available units, the lack of landlords and owners wanting to work with our participants. Unfortunately, our unhoused clients, landlords don't want to rent to, they believe they have a reputation, and it makes it more difficult for them to go ahead and get housed. The other thing that we don't talk about is just the people feel ashamed embarrassed, anxiety, they are depressed when they're homeless. They have no connections to people. The family that they have don't want to deal with them, or they themselves are going through housing issues where they can barely afford their own home and have to tell a mother they can't help her with her 3 kids and she has to go to a shelter. They have to tell a brother, I can't keep you in my housing because I can't afford to have you here. So I think it's a community problem. It's everywhere, and we need changes, right? So one of the things that we were talking about is when people are housed, they are focused on goals. They can be focused on their health. They can be focused on medication. They're like on a flight or fight every single day. Once they have a house to sleep in, because they haven't slept in a bed for 5 years, a shower that they never took, right? And they don't even know how to turn on the AC or down because they've never lived in a unit and it's been for years. They don't have life skills anymore. So teaching life skills, having permanent housing would help a lot. And one of the things that we've noticed is when we actually move people in, they start focusing on their health. They start focusing on their goals. They start getting jobs, increasing their income, graduating from our program. Our program is a self-sufficiency program, so that means that we help with financial assistance, with intensive case management, depending on each person's need. So we might help somebody for 2 months. They might just need 2 months. They might just pay for that 3-month deposit that they ask for. And we help them until they get a job, until they get situated, until they start going into this state of mind that, yes, I'm okay now. I'm going to be fine. And then we graduate people. And then we get another participant to come in. And every single one of them, I can tell you that every single one of them comes in with depression, mental health, they need counseling and assistance. And it's just inhumane, like we were saying. Housing is a need that everyone needs to have. It's a necessity. And our program tries our best to go ahead and graduate participants. We just had a family of a mom with 5 kids. She's working, was housed, and now her kids have childcare. She's able to go ahead and have her job, and she graduated from a program, and she just needed that help, and she was actually running from domestic violence. So that's another thing that we didn't talk about a little bit. It's just moms and women that are just running away from domestic violence, and that they have to go ahead and be put in this situation, unfortunately. So yes, so we definitely need somebody to listen and to help and to assist our community and our neighbor and our clients. Thank you.
Thank you so much. Next, we will be hearing from Alexis.
All right, well, what a great panel, right? We have women who are working in this field every day and supporting our most vulnerable community members. And as a county commissioner, I ran for office specifically on addressing homelessness in Washoe County. We had doubled in homelessness, as in most of the country has, and our emergency shelter had really become a holding place for people to live, no joke, for decades in an emergency shelter. Completely unacceptable. And that would be if you were lucky enough to get in early and get a bed in the emergency shelter. So we knew we had a crisis. The county did not want to deal with it. They had a shelter for women. So women are much more palatable for the county at the time to support with homelessness. The county didn't want to deal with homeless men, which is an epidemic in this country as well, especially with mental illness and behavioral health issues. And And so we work together to build a large shelter where the county works with the cities. And we have now, when we first opened the shelter, we were housing about 30 people a month in permanent housing. Now the county is about at 68 people a month into permanent housing from the shelter, because we are the only county in the state of Nevada that has grown in affordable housing and that has grown in permanent supportive housing, because we have made it a priority over the last 6 years to invest in housing as a region and the county works with the 2 local cities to support incentives for housing. Do we have a perfect system? No. Are there people who fall through the cracks? Yes. Is there more work to do? Absolutely. That's part of the reason that I am running for governor, because we see when we get these folks stably housed, they can live a life of dignity. And it is wrong what we are doing in this state, allowing people to die on our streets and to die in emergency shelter, when we have some of the richest people in the world who live in our state. It makes no sense what we are doing, especially because so many of these people, if you talk to people who live in a shelter or who are living on the street, they worked at one time. They have Social Security. They do have government benefits. They didn't work enough, or they had some sort of personal issue that got them out of the workforce, or they were a caretaker, and guess what? You don't collect Social Security when you're a caretaker. And so everyone comes to it at a different point in their lives. But what I've been seeing as a county commissioner, and what I'm hearing, and I'd love to hear your thoughts on this too, is our seniors are the most affected with our homeless crisis in the state. So half of the homeless shelter in Washoe County is people 55 and over. So seniors that are ending up in emergency shelter. And it's because the rent's too damn high. They can't, these people are, they've been living in pretty stable conditions, but can't afford rent anymore because landlords are allowed, and you heard from many of the speakers, our landlords aren't necessarily always mom and pop landlords that are your next door neighbor that had invested in a fourplex and is supporting a worker, many workers in their complex. Our landlords are hedge funds. Our landlords are corporate entities that do not even have a corporate entity in the state, don't have an vested interest in the state. We saw that all of those homes that were gobbled up during the Great Recession for a deal for $100,000, $45,000, they are all making too much money off of their tenants, or they are renting them for short-term rentals for vacation homes. And our housing stock is in crisis in this state. So I wanted to put together a housing program that talked about how we can support our most vulnerable Nevadans who need to get out of emergency shelter, and how we also work on supporting our workforce housing, our hardworking young people who want to invest in homes, and everywhere in between. And so the first thing that I have put out for the housing program is an executive order that we freeze rents, that we call Nevada a housing emergency, and we freeze rents on day one. This is temporary because the legislature actually has to approve legislation long-term for this, but it's how we can keep, especially our seniors, stably housed. The other piece that would go along with this legislation is making folks who, corporate ownership of homes, pay a different rate of property tax. They are getting a steal with this state right now. Our state has a backwards property tax system that works for a working person whose income is fixed. So your home depreciates with the age of the house, and so does your property tax. And that works if you are an individual who is trying to stay stably housed in your home. But if you're a corporate entity that bought a house that is older but valued at a higher price, you were not assessed at that value. You were assessed on the age of the home. And so we have got to fix that and make sure that if you are a corporate entity, that you are paying your fair share to do business in this state. I think it's what we saw from the last legislative session is legislators talking about capping corporate ownership of homes. Did everyone see that that was a big discussion? So that happened during the general session, and that also happened during the special session. It didn't end up getting passed, but there was a lot of bipartisan support for that bill. The problem was the cap of the corporate ownership of homes was 1,000 homes. That is a lot of homes for one entity to own. And there was no change of tax for those homes. So you could still own 1,000 homes, then you can open up, because Nevada is so opaque with our business laws, you can open up another LLC and just put 1,000 homes under that. And open up another LLC and put 1,000 homes under that. So it doesn't really fix the problem. The one nice piece of that legislation, it would require registration of these organizations that own these homes. UNLV did a study of corporate ownership of homes in Nevada, and it was a very difficult study for them to conduct because you don't know who owns these homes. It's very opaque in the state who owns the housing stock in Nevada, but they now are thinking it's over 25% of the housing stock in Clark County alone is corporate ownership of homes. So the idea is that you put that tax in an affordable housing trust fund, and then you make the local governments accountable to get all levels of housing online with the money. So it's both a carrot and stick, because I understand that the governor is not making zoning decisions in every part of the community. The governor can lead on that, and there is a real lack of leadership. And what you heard from Catrina about permanent supportive housing, I think is the one piece where we in this state could actually solve, for the most part, the homelessness crisis if we could get enough permanent supportive housing online. How many units do you know in Clark County that do you need? It's gotta be, yeah, it's a lot. It's a lot, but, and permanent supportive housing is the type of housing that's more expensive to build because it's almost like a nursing care facility in some ways, because it's people who are special needs. It's gotta be ADA, it's gotta meet these requirements, but we have 50 units in Washoe that we were directly part of receiving grants and investing in. We have another 130 permanent supportive housing units to come online, but there needs to be a priority to get our seniors housed, because these are mainly seniors that need this housing that just don't have enough money to live on their own. The other thing that we need to do long-term in this state to support our working families is we need to make sure that there is down payment assistance to hardworking Nevadans who want to invest in homes. And we can do that if we require that local governments, when they permit housing, that there is diverse housing types, so the missing middle is part of their requirements right now as a developer. Unless a council member or a county commissioner has a lot of influence and will beg you to put some townhomes in that development, for the most part, they're gonna do single family homes, 4 dwelling units to an acre, and it's going to be out of range for anyone to buy that is just a normal Nevadan working a regular job. And in this state, you used to be able to be in the service industry, because that is the backbone of our state, let's remember, and buy a house. What happened to that? And we've allowed Nevada to become a haven for the investor class. In 2015, the legislature actually opened up a giant loophole that does not require investor homes, so people, corporate ownership of homes, or people who are investing in homes in Nevada, to pay an investment tax that we require from every other investor in the state. So we've made it easy and cheap to invest in Nevada, and they are making money off of the hardworking people of this state, and it's unacceptable. And so the only way to deal with this crisis is to actually lead on it and have a plan and have a governor who wants to aggressively tackle it and make every level of government accountable. I think the other piece that I think that the state could really support on is making sure that our landlords cannot discriminate based on the color of money that comes in. So right now, they can say, oh, that's a voucher. No, I don't want you as a tenant. Or you got a shallow subsidy or a subsidy from the county to pay for part of the housing. No. We need to make sure that people can rent homes if they have the cash, regardless of where it comes from. If it comes from the government or it's coming from themselves, because that is making a very difficult market and making it difficult to house our most vulnerable people in this state. And I think that the governor can also lead on homeless services. So it is, I know that the Haven, is it called Haven for Hope? What is it called? Campus for Hope is coming online here soon, which will be an emergency shelter, but I think there's real opportunity for the governor to bring the cities and the county together to work together on homeless services, because right now, and you could tell me if I'm wrong, everyone's kind of doing their own thing for the most part.
Yeah, we're our silo, but there's a lot of collaboration.
You're bringing people together as much as you can. You're bringing people together as much as you can. But I think that with a community so big and with so many governmental entities, the state has a role to play and a leadership role to play that they are not playing right now. And so I think that there's a real opportunity to also make sure that the state supports that. And here's the thing, I will close with, this all takes money. And I'm not looking to tax you. Nevadans pay a higher portion of our wages on gas tax, sales tax, vehicle registration. It is death by a million cuts in Nevada to get services here. We have the highest childcare costs. We have the highest healthcare costs. We have the highest vehicle insurance costs. And so we make it really hard for Nevadans, working Nevadans, to make it here. We have got to tax the people who are not paying their fair share. We have got to bring mining, gaming, and big tech to the table. We need to quit these abatements if they are not working for our state. We are luring companies to come here. For example, we give 75% tax abatements to data centers to come to our state. Do we need to subsidize data centers? Makes no sense. So we have got to make changes and modernize our tax system. We can still be a low tax state. I'm not looking to change that. I'm not looking to add an income tax. I'm looking to make sure that the industries who are making a lot of money off of hardworking Nevadans are paying their fair share. So that is what will pay for what we are discussing tonight as part of my plans. But you're all here for a reason, because you wanted to talk about this issue or you had another question. We have a great panel here. So Caitlin, I'll have you take it away on how we do this next.
Yeah, so now we're gonna be having a Q&A. So we're gonna have people hold their hands up and I'll bring the mic to you guys. So whoever wants to go first on questions.
name is Richard. I'm up in Centennial. Make healthcare affordable. So I've already bent your ear when I first met you 15, 20 minutes ago. I'm on the ACA medical health plan, which is great. And maybe some of my fellow citizen friends around it also. I retired 3 years ago from Boeing. I was a corporate job as an engineer. My medical plan was top notch. I retired. 6 months later, my wife gets cancer. I'm on ACA. 2 years ago, it was $950 a month. Last year, 2025, it was $1,205 a month. This year, because Republicans stalled out the ACA subsidy extension, my medical plan today is $2,401 a month. Wow. A month. That's in addition to the co-pays and the deductibles and everything else. My wife has cancer. We hit those deductibles in January. Her cancer drugs cost $115,000 a month. Wow. Now, that's a gross number. We get subsidies from the manufacturers. But when you have cancer in this country, you're talking millions of dollars a year in gross bills. I lived overseas for 26 years. I've been to 45 countries. I lived in 7 countries. We're the only country in the world where a citizen has to pay $2,401 a month. I lived in Europe. Our doctor, you go see the doctor, the equivalent of 10 US dollars. That's it, 10 bucks. I can have open heart surgery for $10 in Europe. Why we can't do that here, I don't know. Probably because Republicans control Congress and Trump's in the White House. But you said you could make healthcare affordable in that state. So what can you do at the state level to help get some of these subsidies or help any of us in here who have obscene medical bills? Because believe me, $2,401 a month for medical, that hurts. I mean, I'm out of the economy. We don't go out to eat, we don't go to the strip. I can't afford anything because I'm too busy making that monthly check, right? So if you have any state level initiatives to make healthcare affordable, I'd like to hear it.
Absolutely, and I am so sorry again about your wife, and just thinking about you and caregivers as well in this state who should be reimbursed for their caregiving, and that's actually in my plan as well, to reimburse caregivers on the Medicaid reimbursement. But the state of Nevada system is broken. We have some of the most expensive healthcare, the worst outcomes when it comes to healthcare in the state, especially for women, and we have inaccessible healthcare. If you have Parkinson's, for example, or a disease that can't be easily treated, you're going out of state. Trying to find a specialty doctor in Nevada is brutal. Speaking to folks who moved here recently, sometimes they're waiting 3 months plus just to get into a primary care doctor. So there's a shortage of doctors as well. We have got to make sure that we are keeping homegrown doctors and nurses in this state, and that we are subsidizing these kids to stay here. I have a plan to give Nevada students a grant to pay for their schooling if they stay in our communities for a decade and they take Medicare and Medicaid, because that's the other crisis. How many of this is happening throughout the state. So many doctors are now moving to concierge medicine because they don't want to deal with the billing, they don't get reimbursed enough. And so it's also incentivizing those doctors to come back to the healthcare system. And the only way we can do that is if the state increases the Medicaid reimbursement rate and make it so doctors want to be here. The doctors in Nevada make $100,000 less than on average than other doctors of neighboring states. I know several doctors who commute to Arizona to practice, and then they come back to Nevada to live. It's because they're making more money in Arizona. And so we've got to reform the system. Additionally, I want to make sure that the state pays and subsidizes the Battle-Born plan, the public option. That is a plan that I think we could make more robust and a better plan for Nevadans and make it cheaper for Nevadans. I also have a discussion about how we can support some of those subsidies that went away on the federal level. Again, all of this takes money, and Nevada has got to want to modernize our tax system. We have got to want to have the hard discussions with major industries and with the billionaires who live in this state and tell them that they need to pay their fair share. But those are some of the ideas that I have on how I want to improve our healthcare system. And I think that when we invest in ourselves, when we invest in our own healthcare, it actually benefits the whole state economically. I think Nevada could be a great hub for medical tourism as well. Why wouldn't you want to go to Vegas and get a treatment and then go on the Strip? I mean, hey. I think there's opportunities where we invest in ourselves and we invest in our economy as well. And I think that we need a governor who wants to think out of the box on those things, but it needs to be a priority, and it starts with raising the revenues and also investing in the system. The governor has said that he's supported healthcare because he's rebranded the department. So I don't think that goes far enough for any of us, and I don't think we're seeing those results on the ground. It's only gotten worse for most Nevadans. So there's a lot of work to do, but it needs to be a big focus because it's part of the quality of life of our state, and people are suffering, and we can do better.
Thank you. Next.
First of all, I want to applaud you for taking this journey. I know it's not going to be easy, and you're showing a lot of courage, vision, wisdom, and it's exciting. I've lived in Elko, Reno, and Las Vegas for 30 years. I've seen all these Republican governors come and go, and they're just all the same. Paul Laxalt, Robert Liss, there's a whole bunch of them. I see Lombardo's face on these billboards, and the message underneath doesn't amount to anything except vote for me. I have no idea what this guy stands for, and I doubt he knows. So I'm asking you, what's your message going to be when we see your face on that billboard?
Well, I'm running a grassroots campaign, so you're not going to see a billboard yet. But after the primary, yes, I want to talk about putting Nevadans first. That's really the message that I think we need our governor to care about, is putting real people first in this state instead of continuing to honestly sell out to major industries. And I think we know what our governor is all about by looking at who donates to him. So one single mining company, which doesn't even have a corporate headquarters in the United States, they're Canadian, have given him over $1 million for his campaigns. That's why he's conveniently fired the water engineer, and there's no accountability on natural resources in our state right now. Follow the money. We've got to change the way that we regulate campaign finance law in this state, and we can do that on the state level. Right now in the state of Nevada, you can give $10,000 yourself to a candidate, and then your husband can give, or partner can give $10,000, and then your corporate entity can give $10,000, your LLC can give $10,000. So this is where the bundling comes in, where you've seen huge donations go into PACs, and then those same people can then go ahead and donate to the campaign of the individual candidate. And you can't tell me that that much money doesn't buy problematic influence, where it's above and beyond the people. And I had a legislator tell me, I wish that the people had a lobbyist. And I'm like, that's your job. That's our job. Our job is to lobby for you. That's what we need to be doing. And I think we're losing that because we're so obsessive about how much money is in campaign coffers and making sure that you win that next election instead of actually making sure that you want to get things done for the people for long-term success. Because that's why I'm doing this. It's, you know, some people have told me, you have too many agenda items. And I'm like, yeah, because this state needs a lot of help. I think we should have an incredibly ambitious governor who wants to tackle all of these issues, because where do you even start? Healthcare, housing, I mean, mental health, childcare, schools, jobs. There's so much opportunity for real investment and real engagement by our state that we're missing it. There's no leadership there. There's only leadership if big industry says, hey, we're not happy with this regulator. That's where the leadership comes in. Okay, we'll fire that person. So we need wholesale change in this state, but Nevadans first, absolutely.
Thank you.
All right, I have a question for you about. Oh, I apologize.
You're totally good. Go for it.
You say Nevada's first. What's a Nevadan?
What's a Nevadan? I mean, it's anyone who lives here.
Carpetbaggers here.
I mean, here, listen, I was actually thinking you were thinking more on like, what are my immigration policies, which I want to protect folks who come here and make sure that they're not quietly disappeared, unlike our governor. But what do you mean by we have a lot of carpetbaggers here?
A lot of Californians have moved here, and I moved here when I was 21. It's the only place I ever wanted to live, growing up in Hawaii. And so I'm not a carpetbagger, but you could call me that. Somebody who comes from somewhere else and tries to bring in their thought process and everything else. Nevada used to be a great blue state, and now we're kind of red. That's what I mean by carpetbaggers, bringing in your own thought process and everything else. It comes from the Civil War.
Yeah, no, I hear what you're saying. So I think that's the joy of being Nevadan, because I was interviewed and the woman was shocked that I grew up I was born here, which is like a rare thing in Nevada. This is a place where people come from all over the world to try to make it. So I'm fine with that. I'm like, come and bring it, but you gotta be willing to pay your fair share. That's like, I think we have set a precedent that you can come into the state and just take advantage of all of us. And that's where I have a problem. I mean, the fact that Nevada is voted for Trump is still mind-blowing for me. I can't even believe it. And there's a lot that went into why that happened, which we can always discuss over a glass of wine if you want to. But I think what Democrats have to remember and learn as part of that is, how are we going to motivate people who are not ideologically exactly the same as us to come out and support us? And I don't think, I don't know if we have done a great job about that, because I think legitimately some people are seeing that the parties are very similar because they are bending to the same special interests and not necessarily fighting for the working person. And I think that there's a real opportunity for us to differentiate ourselves and say, listen, I can't fix gas prices. We're dependent on California. We're not gonna run a new pipeline to get us gas. So like, let's be real here. I can't fix grocery prices, but I can make it cheaper for you to get to work. I can support you with your childcare. I can make it so your healthcare isn't astronomical. I can make it so you can live and work in the same place. So I think for me, as long as people who want to come here are willing to pay their fair share, I'm okay with it. But were you hoping to have a different discussion on that?
No,
okay, out of curiosity.
What is the definition of Nevada first? Because I mean, statewide it's 60 days or something like that, 30 days.
Yeah.
And then my next question is Aaron Ford and PACS. When was the last time Nevada had a governor that won from grassroots?
I mean, hey, could it be this cycle? Because if there was ever a chance for a dark horse to win, this is the time. People are pissed. Everywhere I go, people are like not okay with what's happening, and they want something new. And we just did a poll, my campaign, and I fare better against Joe Lombardo in a general election. That's just real. That's what we just found out from a poll. And so I think that Nevadans have to be willing to maybe support a candidate who is not the most well-financed candidate. Support a candidate who's willing to do town halls, and not every contact that I have with a voter is, give me $5, give me $10. I can't ask you to do that if you don't know what I want to do for you and you're not bought into the message. And so we're building this thing. We're out there talking to folks. I've been on the trail since September, and we believe only 155,000 people are going to show up to this election. That's it. And so unless we grow the electorate, engage new Nevadans, which I think is going to take time and something I want to do as the leader of the state and leader of the party, we've got to decide as a party, what do we want? Do we want someone who's going to give us platitudes, or actually have a hard discussion with us, tell us how we're going to finance things, and get to work, roll up the sleeves? So that's what I'm all about. Yeah, thank you. Yes.
Hi, good evening, Ms. Alexis Hill. Thank you for being here.
Yes.
My name is Alejandra Ali Holmes. I'm a person who worked in nonprofit for about 13 years, and a person, most importantly, with lived experience in homelessness within my childhood and housing instability. Having worked in the nonprofit sector, I have seen a lot of clients that have lots of different barriers, not just housing, not just mental health, not just recovery or reentry. And with that, I had a question on how would you propose, oftentimes here in Clark County and in a lot of the state, nonprofits often focus on being number one and being the one-stop shop, instead of working together to assist our most vulnerable populations. How would you propose to address and correct this? And also, is there any way to require interdisciplinary case management and attach that to state funding and state grants?
Yeah, great question. What nonprofit do you work for?
I'm a lived experience, lived ex-consultant with Nevadan.
Oh, yay! Yeah, representing. That's awesome. And congratulations on all the things that you were able to overcome, and thank you for continuing to support the community. I think that the state has got to, this is where I think the leadership comes in, and to really get into specifics, since I think you like to probably nerd out on homeless policy. So for my county, we require that any nonprofit who wants homeless dollars, they have to work in HMIS. So they have to work as part of the HMIS, for folks that don't know, is the federal database to ensure that you are speaking the same language and you know who is homeless, and you're case working them efficiently, and you're working across all different nonprofits and organizations to get them the help that they need. So many times we were having people work off spreadsheets, not coordinate with each other, not support those needs, and then we were giving them money. I have no idea why we were doing that, because they were essentially working in direct competition with the work that we were trying to do at the county. I think there's opportunity to require that as part of bringing our counties together. I'll tell you, so our shelter in Northern Nevada receives people from Clark County. And our shelter is the shelter for all of Northern Nevada, because there are no other shelters in the state. And so I think the state has got to make it their problem and invest in it. And as far as multidisciplinary, are you thinking like specifically on case management? Could you just give me an example of what that would look like?
For example, we have a lot of nonprofits that do specifically housing, and they house persons who are experiencing homelessness or housing instability. But oftentimes those clients also have mental health barriers, substance abuse barriers, or are in re-entry. So even though you're assisting them with getting housing for 2 months, 6 months, 12 months, after that fact, it's still hard for a lot of them to get jobs, for example, and let alone sustainable jobs that will help actually pay their rent. So when I talk about interdisciplinary case management here in Clark County, I'm talking about those nonprofits actually working together to help wrap around that support onto that client so that they can have that mental health assistance, that workforce assistance, that housing assistance, etc.
And I will give the state a tiny bit of credit for something that they're doing. So they do right now a grant for communities who want to do tenancy support. So when you leave the shelter, you then go and make sure that these people stay stably housed. You're checking in on them. You're making sure that they've got food in the refrigerator. They're going to the doctor. They're going to group therapy, whatever the case may be. I think that needs to be expanded and supported, and that we know when you have tenancy support, so it's essentially like having a mom in some ways to check in on you, you stay stably housed 98% of the time. It's like amazing, and you're a better tenant because they're also, helping folks stay housed and supported. But I'd love to hear from our experts as well, what your thoughts are on that.
Am I talking about interdisciplinary? Okay, so I think that, so when we talk about state funds, we have to understand that, like, when we get federal funds, it goes through our continuums of care, which I'm not sure if they work directly with the state or they're their own entity. We have three different COCs, right? And so it kind of depends on the funding, but I think that, like, for instance, I worked with veterans for 9 years, and with those VA funds that our agencies got, we had to have coordinated community plans with the other agencies in the community that got them, not just HMIS. Everybody was trained the same way. Our forms looked the same with the different agency logos on it, and we had like mandatory training directly from the funding sources. So in order to get this funding, you have to abide by it because we know what the best practices are, type thing, right? So I know at Nevadan Homeless Alliance, we created and paid a trainer to create interdisciplinary, I don't know if you even know this, case management. So I can have a client, and this is not my client. This is, if this client is homeless in the middle and they're low income and they have this issue and their kids are in CPS and they need to do a class and they have this issue and they have trauma, they need to be connected to everything out there. So it's not my client, and I'm not getting mad at the other person because you had an appointment over there and you come to mine. We need to all be working together. I've always thought that funding sources, when they give funding to multiple entities, should have something concrete like that to ensure that people are collaborating and working together and not in silos. I think funding sources can do that, but like, there's so many different funding sources, right? And so I like that idea, but on the state level, I don't know how that would work, but I think on county levels and city levels, they can put stuff into their guidance about that. And I don't know like what the ratio is of in the communities, how much funding is state, how much money is city or this jurisdiction versus how much funding for housing is county. Like, I don't know what those numbers look like. And I think it's pretty hard for all of them to work together to have the same rules, but to have some type of interdisciplinary standard, I think is important, but that's just me.
All right, we have time for one more question.
Well, we got
make a
three
section.
more.
Yeah, we'll do it.
Are they kicking us out?
No.
Okay.
Hello. First of all, thank you for having this. Shout out to our very good friend, Dr. Catrina. We work side by side with the Nevadan Homeless Alliance. Give it up for our organization, please. Governor Alexis Hill, and yes, I'm gonna say it out loud. You have our full support. I am with See the Unseen Foundation. Here's what we do. To piggyback off of what you just mentioned earlier, this is not a question, this is more like what we've been doing, working with, especially with Dr. Catrina. We have figured out a way how to not be dependent on the government. We have yet to receive a single penny from the government. This nonprofit organization, I built this from the ground up. I was homeless myself when I was 17 years old. Moved from San Jose, California to Las Vegas, still struggling, right? But I thought our homeless folks here have it worse than in California because of the weather. Someone rich should do something. I became the person that I needed when I was struggling. I may not be rich. However, I had 28 properties across the valley. That is equivalent to 224 beds. Most of the people that we house used to be homeless. Now, they are what we call? Family members. We have created a family culture to where we're thriving. Before we came here, we were in a meeting with medical and non-medical professionals. Yesterday, I was in a meeting with a psychiatric mental nurse practitioner, who is also a primary care nurse practitioner. We are working with them. All of these private organizations, private businesses are supporting us so that our family members don't have to pay $1,200, $1,800, $1,500. The lowest we've ever charged for a bed space is $375, as long as they qualify through our affiliates programs, because they also need to make money. These are medical professionals, just like what you mentioned earlier, sir. They need to make their money so they can make ends meet. Is that what I'm saying? Sorry, my English is very poor today. So figured a way how to work with private organizations to where now they're sponsoring a portion of their bed space so that our people can live, can breathe, can save money, right? Because there's nothing worse when you're fighting for your life and then you don't have a lot of money because you're so worried about affordability. How can you afford something when everything that you got, you have to pay for your rent? There are private organizations out there who have become non-profit organizations, and that is See the Unseen Foundation. Thank you.
Yes, and we've met, and you have an incredible model, and can't wait to chat with your family members, yeah, about the organization. Is that the last question? All right, one more? Yeah, go ahead.
Oh, hello. Sorry. My name is Willie. I am the founder of Las Vegas for Better Transit. We're a group that's trying to advocate for improved access to public transportation in Southern Nevada. And of course, I'm a little biased here. I like trains. I really like trains. I like public transit because it's, when done right, public transit is a very affordable way of getting around. And dare I say, it's a very fun way of getting around. Like, you just have this person that drives for you. But, you know, I've been thinking about improving access to public transit and how that relates to the affordability crisis in Southern Nevada. And, you know, for me, like, I'm young. I kind of look young, but I'm young, and people of my generation, it's, you know, as one of our panelists said, like, it's kind of hard. It's a little rough. And for me, housing and the cost of getting around, they kind of go hand in hand for me. So I'm thinking about the RTC of Southern Nevada, which runs the buses over here, and how crazy it is that they just run buses. They don't have trains or subways. You know, we're the largest metro region in the country without passenger rail. Like, we're a world-class city. People from all across the country and the world come to Vegas to have a good time. But our own residents, we have a bus system that is very unreliable, and I know that because I tried taking it from Centennial Hills to past the airport for a committee meeting for the regional rail working group that the legislature is trying to form to figure out how to increase access to transit. So we have 2.4 million people in the Las Vegas metro area, and the best we can do is a monorail that's like more of a tourist attraction than a real way of getting around for the residents who provide the experiences that make the economy work. So long story short, I'm just really curious on what your position is on investing in transportation in in Nevada more generally. And the more technical question for you, what role do you see public transit and transit-oriented development, since you mentioned the missing middle housing, what role do you see public transit and transit-oriented development in helping making housing more affordable and creating a better sense of community for people across Nevada?
Absolutely. And we know that transportation is tied to housing, right? Because you have to get to work from your house. And transit-oriented development just essentially means it's dense enough that you can make the transportation work. And I think this is where I think there's opportunity for the state to work with the local governments to push on this a bit and to ask them to make their urban cores denser and to ensure that you can actually have great public transit. Because in Vegas, for example, we're serving two different masters. We've got our tourists, which we should have light rail for them, period, on the Strip. That it's crazy that we don't. The reason we don't is we don't want to pay for it, because it turns out transportation is extremely expensive, but it is a worthy investment, as you were talking about, and we need to get workers to work and people around. We need to move people around the city and make it easier for people to move around the city. And that also takes investment, that takes discipline with your zoning, and to actually require that you have corridors where transit makes sense fiscally. And we love to sprawl in this state. We have a lot of single family housing, and hey, that's the dream and why so many people came here. I understand it, but I think that there are parts of this community that deserve light rail or some sort of investment of trains and really good, reliable public transportation. Right now, the reason that you see the Visitors Authority partnering with the Boring Company and Elon Musk to move tourists around from the airport to the Strip is because it's a crisis, and yet there's no money to pay for it. So we have an unregulated company boring holes under the Strip, our economic engine of the state, which seems problematic in and of itself. And then now we're going to give them the monorail tracks to run Teslas on instead of even public transportation, cars. And so, and it's because there is no, if you talk to any city who has gotten light rail in their communities, you ask them, how did you do it? They say, everyone wanted it, from the governor to our state senators, to our congress people, to our mayors, to our county commission. Everyone said, we're gonna do this. And they worked on it, and they made it a priority, and those people used their political will to get it done. And right now, there's no one leading on that issue. So the visitors are the ones that are getting the priority, because that's where the money's coming from. Even though we're not investing really any money, we're just giving land and opportunity to one company and the most wealthy man in the world, Elon Musk, who got Trump elected. So we're doing that right now, but we're not even prioritizing getting our workers and our community members around this incredible county. So it's going to take money and real leadership on all levels. I think that that interim committee is a good start. It feels like decades late, but it's a good start. The crazy thing is, because Nevada is, and to just get really technical for 10 seconds, we are not a home rule state. So your county and your cities can't say, we're gonna do a rail authority. and create one. We have to go to the legislature to even ask to get a rail authority created. We have to go to the legislature to actually even raise the revenues to have enough money to start that rail authority. So it's all at the state level. And I'm not giving your local governments a free pass here. We have work to do as well. But the state really needs to make it a priority to move people around in an easier way. And what is happening in Las Vegas, as well as all over the state, is unacceptable. So you just need someone who wants to prioritize it. I certainly want to. And I think that there are people demanding it in this community, and we should demand it at the ballot box and ask all the people who are running, our assembly people who run every 2 years, who are going to be on your ballot, and our state senators and your future governor, as well as your local county and city reps, what they're going to do about public transit, so you can get people who are aligned, who want to make it a priority. But that's what I would like to do. Absolutely.
That's our final question.
Okay, Caitlin, do you want to?
So now, if you guys would like to take a photo with Alexis, you guys could go over there in the back, and we'll take a photo.
And before you all scatter, we'd love a photo. But if you believe in this, if you want change for this state, I can't do this alone. This is a grassroots campaign. I need your help. If you want to volunteer, if you want to give me a small dollar donation, if you want to tell your friends about me and have a house party and have me meet your friends, I mean, literally, this is grassroots. I need you all. If you want change in this state, you have to actually work for it. And so let's work for it together, but come on up and let's take a picture. Thank you.